You can hear me, but they can't hear me in the room.
We can hear you. Hold on. We've muted this on this end.
Okay.
Sorry, yeah, in room we muted.
Okay, that's
Sorry.
what I'm checking. Okay, all good.
We're going to mute for just a couple more minutes, everyone.
Okay, no worries, I just was checking.
This is one of our best podcasts.
Just need to start my camera.
Go ahead.
Oh, you know. I don't know if that's a problem or not. Can we record on that? No, wait, it doesn't matter. I won't have the interpreter to be able to, unless this is going to be the most ridiculous thing you ever heard, but I may have to download my YouTube feed to edit off of that.
But why do you need to edit off of it if we're just doing the whole?
He's going to have, he'll have cuts. Anyway.
Well, this recording too gets downloaded and. Poquito.
If it gets too hot for you, that's right.
Okay. Oh, they're doing checkout. My wife got called into work, and now she has to go Monday, Tuesday, Wednesday. All in caps. Bad news. So she's not happy. It's funny. They've been making her do these packets, watch videos, and do this like crazy.
So are we live on the webinar?
The broadcast is now starting. All
Perfect,
attendees
perfect.
are in listen-only mode.
Good afternoon. Welcome everybody to this press conference from the Unified Command here in Maricopa County on May 13th. My name is Fields Mosley. I'm the Communications Director for Maricopa County and the Lead Public Information Officer for the Unified Command. I'd like to thank all the reporters who are joining us today, and we always appreciate all your questions you have for us every time we hold one of these news conferences. Also like to thank the public for joining us via YouTube and via Facebook today. We appreciate you being with us, getting some information directly from our leaders here at the Public Health Department and the Emergency Management Department, as well as our partners. So today we're going to talk about a very important subject related to the pandemic that everyone's dealing with across this country. We're going to talk about contact tracing. Maricopa County Department of Public Health conducts contact tracing all the time for all sorts of diseases. Of course, they had to shift a lot more people into investigations as COVID-19 cases grew over the past 2.5 months. Dr. Sonnenschein detailed COVID-19 contact tracing and the creation of a plan 3 weeks ago now. It had to be scalable. It also had to be sustainable. And we know we're in this for the long term. So those are very important things to remember. Today you're going to hear from Public Health Executive Director Marcy Flanagan, Medical Director Dr. Rebecca Sonnenschein. They will give you details about our progress as we ramp up even more contact tracing in our community. We also have a couple of key partners with this contact tracing program, and one of them is with us today, Crisis Response Network, or 211. They're a big part of this, but we have Maureen Rowland from Banner Poison and Drug Information Center, also a key partner with this program, and she'll talk a little bit about what their role is and how they can help contact tracing and provide expertise in this area. When we get to the question and answer period, I also have Robert Rowley. He is our Director of Emergency Management, in case any of the reporters joining us today have questions about personal protective equipment and our supplies and where we're distributing those supplies. So a couple of quick logistics before we get rolling here today. Members of the media, you'll be called upon, as always, by our moderator on the GoToWebinar to raise your hand. And once you raise your hand, please make sure you are not self-muted. We cannot unmute your microphone from here, but we will unmute your microphone and call on you to ask your question. And as always, Chad will be corresponding with you via the text feature on the GoToWebinar as well if you're having difficulty. If you are having difficulty at all, or the hand is not raising within the GoToWebinar, you might have to log out of that software and then log back in. That usually fixes most problems, and you're able to join us at that point. So also we will have Joanna Molina here today, as we have for the last few weeks. She is a public information officer at the Department of Public Health, and she will be translating answers during the question and answer period into Spanish. And we hope that helps out our friends in the Spanish language media and those who are bilingual or Spanish-only speakers. So with that, I invite the Executive Director of Public Health to join us up here, and that is Marcy Flanagan.
Good afternoon. My name is Marcy Flanagan. That's M-A-R-C-Y F-L-A-N-A-G-A-N. And I am the Executive Director for Maricopa County Department of Public Health. So contact tracing has been an essential component of public health for centuries. And it's a key strategy we use in preventing the further spread of diseases, and specifically COVID-19 lately. The basic premise of contact tracing is that public health staff work with an infected person or a case to help them recall everyone that they came into contact with, including their close household contacts, employers, and healthcare providers that may have cared for them while they were infected. We reach out to those close contacts and inform them of the possible exposure and provide them with clear guidance as rapidly and sensitively as possible. We have received many questions lately on Maricopa County Department of Public Health plan for increasing our contact tracing as testing has increased lately. And we have been working very hard over the past few weeks to create this plan. Just to give a little bit of background, prior to the COVID-19 pandemic, Maricopa County Department of Public Health employed 16 epidemiology investigators whose role it was to interview individuals with infectious diseases like pertussis and mumps. During an interview with a positive case, The epi investigators would have an in-depth discussion with the case about who they may have exposed, where they work, and where they may have been treated for their illness, and information on their disease so they know how to keep themselves and their loved ones safe. This includes getting information about everyone in their household because we know that these are the individuals with highest risk of exposure. In addition, these same investigators also serve as contact tracers. They reach out to the close contacts who may have been exposed and let them know that they may have been exposed to an infectious disease. They identify if contacts may be experiencing symptoms, what symptoms to watch for, and provide guidance and answers. After this pandemic began, Public Health began to reorganize its epidemiology team to respond to COVID-19, and we reassigned all of our staff to be contacting positive cases. In order to ensure that we could reach all positive cases, we defaulted to using a case-mediated contact tracing plan. This means that our epidemiologists were asking positive cases to inform their close contacts and household contacts that they may have been exposed. We provided written guidelines for those individuals on what they needed to watch for symptoms and how to stay safe. This expansion resulted in about 25 investigators in our department running a 7-day operation. A few weeks ago, as testing began ramping up, we recognized we needed to increase our number of investigators and contact tracers. We immediately began thinking about creating a sustainable operation that could stand the test of time. We considered what work needed to be done at Public Health and what work we could outsource. We also recognized that volunteers are a valuable resource during this response, but we wanted to make sure we built a system that could be sustainable for the next 6 to 12 months. With Maricopa County Administration and Board of Supervisors support, Public Health is excited to announce our plan for ensuring that all cases and contacts are contacted. I want to make sure to first give a shout out to all of our staff who have been working very hard on this pandemic since the beginning of our first case in January. I'm so honored and excited every day to come to work with a group of individuals that are so dedicated to public health and keeping our community safe. These are truly our public health heroes. I'm eager to implement a plan that is going to help support these staff and continue to respond to this pandemic. It is our goal to ensure that by July 1st, Public Health has the capacity to contact 400 to 500 cases a day. We will be doing this 7 days a week, and all close contacts will be directly contacted. As cases continue to increase, the plan we have built will allow us to have a structure that we can also expand upon and integrate additional staff as needed. So the staffing and what that looks like. It will consist of investigators. These are individuals that will talk directly to a positive case, and they require a higher level of training than just contact tracers do. Maricopa County administrators have been very supportive in public health in bringing on more full-time public health investigators to meet our community need. Usually the hiring process for the county can take a typical 45-day period, but with the help from County Human Resources, Administration, and Workforce Development Team in Human Resources, in a matter of 10 days, we've been able to draft job descriptions, interview, and offer positions to over 33 people. This week, our first cohort of 14 new investigators began training at Public Health. The next staffing that we will bring on are contact tracers. Contact tracers reach out to people whom positive cases have had contact with and are while infectious. Maricopa County has also partnered with Arizona 211, AZ 211, to oversee the contact tracing portion of our operation. AZ 211 will hire staff who, in conjunction with public health staff, will reach out to all contacts of COVID-19 positive cases. In addition, AZ 211 will provide social service support and referral to COVID positive cases and their contacts. We also will have medical support. Often, public health receives calls about COVID-19 medical questions coming in from the community. We have an ongoing contract with Banner Poison and Drug Information Center to assist us with this medical surge. In addition, we've expanded their contract to help support the scope of AZ-211 with technical support should case contacts have questions that they cannot answer. Next is the training of these individuals. So case investigation training requires a fair amount of training. It's important for public health to make sure that these individuals are trained so that when they reach out to a positive case, they understand several things. The first is that patient confidentiality is so important so that individuals feel safe sharing their information with public health. The patient confidentiality that we use is even more stringent than HIPAA. They also need to learn proper investigating skills, such as how to remain calm when an individual they are working with is under a lot of stress. They also need to learn knowledge of the disease and how it's spread so that they are able to answer questions from the case. They also learn the process for identifying who may be considered a contact and how to talk to household contacts and what guidelines are necessary for them. And finally, what occupations are high risk and when employers need to be contacted. Public Health is currently onboarding its new staff, and they are learning about the incident command structure, National Incident Management System. They're receiving training on various electronic databases, receiving confidentiality training, COVID-19 training, and attending a Maricopa County orientation that will be partnered with a seasoned investigator once all that is done. After this initial training, our new staff may, as soon as 3 days after hire, start helping with case investigations. However, full training takes 3 to 4 weeks before these investigators can work independently. Contact tracers require less training than investigators. Staff will be trained on phone skills, COVID-19 disease and spread, use of data management system, and training on social services. I'm now going to turn it over to Dr. Rebecca Sonnenschein, who's going to walk through the details of the operation of our case investigations and contact tracers.
Thank you, Marcy, and good afternoon. I'm Rebecca Sonnenschein, Medical Director for Disease Control. That's REBECCA-SUNENSHINE. So let's talk about what actually happens during a case investigation and how we do contact tracing. When public health is notified of a positive test result, which is usually PCR, but it could be an antigen test, we open up an investigation. Starting as early as next week, once we receive a positive test, we will send a text message immediately to the case in both English and Spanish with a link to a survey that's secure that will collect their initial symptoms and provide tailored instructions to follow until they get a call from a public health employee. This will ensure that the case knows how to remain in isolation and away from others, and it will also help us expedite the investigation. It is important that people know that we will not be asking for personal health or identifying information or financial information through this survey, and if someone receives a text or a phone call asking for this type of information, it is not Maricopa County Department of Public Health. Banner Poison Control Center will be available to answer questions should people have them between the time when they get the text and when they receive their direct phone call from public health. Within a few days of receiving the positive test, public health investigators will call cases directly and conduct a detailed investigation asking questions including, but not limited to, when symptoms began, where and when they may have been seen by a healthcare provider, any chronic health conditions, where they work, and who is living in their household. In addition, the investigator will work with the positive case to identify any person outside of the household who may have been exposed beginning 48 hours prior to when the case first developed symptoms, and to answer any questions that the case may have. The investigator will also request that the positive case enroll in a secure electronic symptoms system to track their symptoms for at least 10 days after their symptoms started, so that we can tell them when they no longer need to isolate away from everyone else. The investigator provides the person with detailed instructions to follow for infection control, both for themselves and their household, managing their health, and when they would need to seek additional care. If the case needs assistance caring for themselves while isolated, they are connected to 211 operators so that any social service needs can be provided. The investigator will talk to household contacts, check to see if anyone in the household is also having symptoms, and provide guidance for infection control, and also ask for permission to sign individuals in the household up for this electronic symptom tracker. Household contacts and close contacts will be asked to check in daily via daily text or email to report symptoms securely to public health. If contacts do develop symptoms, they will be contacted by an investigator and provided next steps in getting tested, appropriate health care, and isolation. If these individuals then test positive, the process starts all over again. Well, what about close contacts who live outside of the household? After a public health investigator identifies contacts outside of the home who may have been exposed to the positive case beginning 48 hours before the case's symptoms started, these cases are shared via the SARA Alert system, which is a secure database that transmits the information to AZ211. 211 operators then begin the contact tracing process by contacting those individuals and determining if the contact is symptomatic, providing guidance, and providing referrals to social services if they are needed. If the close contact needs medical guidance, they are referred to their primary care provider or to the Banner Poison Control Center, where staff nurses can provide clinical advice. 211 will then sign individuals up to be a part of the SARA Alert's 14-day symptom tracker. Cases and close contacts continue to receive daily reminders from the SARA Alert system for 14 days to report any symptoms that they develop. If a close contact reports symptoms to the 211 symptom tracker or through the SARA Alert system, that case is then considered a probable positive case. Then they will receive a call from a live person from public health with guidance and information on how to get tested, and then the whole process starts over again. If these individuals who are tracking their symptoms do not report any symptoms during the 14-day monitoring period, then that process for that person is complete after the last day following 14 days from the exposure to the case. So now I would like to introduce you to registered nurse Maureen Rowland, who is the managing director of the Banner Poison and Drug Information Center, who has been a steadfast partner of public health for many years.
Thank you, Dr. Sonnenschein. We're extremely honored to be here and really proud to be part of this expansion of services that Maricopa County Department of Public Health is doing. The Banner Poison and Drug Information Center is housed under Banner University Medical Center Phoenix, and we receive a medical direction through the Department of Medical Toxicology. We are 24/7, and again, primarily staffed with registered nurses, pharmacists, as well as paramedics, EMTs, that are helping to assist answer the call. We began the partnership with the coronavirus hotline with Maricopa County actually in January, when we first started seeing cases here in the state. So since then, we have actually received over 15,000 calls to the Banner Poison and Drug Information Center, of which many of those were medical in nature. 211 began the partnership with the coronavirus line, or COVID-19 hotline, in early March, and so we've had a working relationship with 211 for a long period of time. We are 24/7 again and available to answer calls regarding anything coronavirus related. With this new contact tracing, we expect to see a lot of people who continue to be fearful and concerned about what's going on in the community, and our registered nurses are there to answer the call at any time.
Thank you so much, Maureen, and Rebecca and Marcy, for all the information today. We know it's a lot of information. We certainly want to make sure that everybody out there understands the complexity of contact tracing and how serious this is in being able to surveil a disease in our community and also to give people rapid treatment if they need that. So at this point, we will open it up to questions for those that are on the webinar. And Chad, do we have anybody with their hand raised?
We do not at this time.
Okay, so we'll give it just 30 seconds more. Maybe our explanation was so very thorough that everybody knows what they found out what they needed to know today about contact tracing. I think it's fair to say to go back to the desire to make this particular plan, put it into place and make sure we're hiring enough people, but hiring them wisely and getting the right people in place to do contact tracing for the long haul and bring those employees on in a wise way. And that certainly started this week. So Chad, anybody out there that has a question for
we
public
do
health?
know Colleen Sikora has a question. Colleen, your microphone
Okay.
is unmuted.
So Chad, I don't know about you, but we're not able to understand anything that she's saying on the line. Can she type you?
Me neither. We'll move on to Ocio Hernandez.
Okay. And also, just so if she wants to type her question, you deliver her question, we can do that as well.
Absolutely.
Hi, can you hear me?
Yes, we can.
My question is on the expansion of the staffing of the contact tracing team. Will those individuals that were newly hired, will they stay on even after this coronavirus pandemic hopefully is over?
So the question is really about the long-term viability of this program and how long these employees might stay with public health. Marcy Flanagan, the Executive Director of the Department of Public Health, will take that question.
Hi, thank you for that question. Our intent is definitely to try to keep some of these staff on board. We are hiring a significant amount of staff. We certainly wouldn't be able to keep all of them on board, but we will be hoping to expand our staff slightly. So if we ever need to scale up again, it will be that much closer to making that happen.
La pregunta fue que si la expansión de personal se quedará después de que pase la pandemia. La respuesta es que es la esperanza de que se quede mucho de ese personal que se ha entrenado en estas nuevas posiciones. Sin embargo, no se va a poder quedar todo el personal, pero es la intención de que tengamos una fuerza laboral mucho mayor que la que tenemos ahorita.
Thank you very much for the question. I think it's also fair to say that we can't predict the future. We don't know when a vaccine will be available, and we might very well be conducting this level of contact tracing for a long period of time. So, Marcy Flanagan, as the Director of Department of Public Health, will make those business decisions as we move forward. But for at least the immediate term, we're hiring a number of people and training them as fast as possible. So, Chad, at this point, do we have somebody else on the line?
We do. Ann Ryman has a question, and your microphone is live.
Hi, can you hear me okay?
I can, Ann. Go ahead.
Thank you. The last week I noticed there is the most deaths that have been reported in long-term care since the outbreak began. And I'm wondering, are you concerned as Arizona begins to open up that we'll see a lot more cases in these long-term care facilities? And is the county doing anything differently or providing any additional guidance to these facilities?
All good questions about long-term care facilities and how we're reacting to that from the public health point of view. Dr. Sonnenschein will take that question.
Yes, we are definitely tracking the number of deaths and the number of cases in long-term care facilities very closely. And as I've mentioned before, we have been working with long-term care facilities from the very beginning, reaching out to them on a regular basis to ensure that anybody who develops symptoms, either a resident or staff, gets tested immediately, and that we're providing guidance to those facilities. In addition to that, after the White House required a certain number of facilities, the Medicare facilities, to be tested, We had already been developing a plan to test all of our long-term care facilities, including those Medicare facilities. So we are building up a team to offer testing to facilities based on their level of risk, and we hope to achieve testing of all residents and staff over the next weeks to months to make sure that we can identify individuals who have COVID-19, both who are showing symptoms and those who are not, and making sure that they are appropriately isolated and cohorted together to keep the rest of the residents safe.
La pregunta fue que si la última semana se ha visto el número mayor de casos de muertes en centros de cuidado de largo plazo, ¿qué se está haciendo al respecto si hay nuevos lineamientos por parte de salud pública? Basado en la respuesta del día de hoy es que se le da seguimiento constantemente a estos centros de cuidado médico de largo plazo para identificar tanto muertes como los posibles casos. También basado en las guías de la Casa Blanca, se ha pedido que todos los que tengan una licencia de Medicare, a esas instituciones se les haga las pruebas a todos los residentes, tanto los que tengan síntomas como los que no tengan síntomas. Basado en eso podemos saber cómo está sucediendo en esos centros de cuidado a largo plazo para que estén más seguros.
And thank you so much for the questions. Chad, do we have anybody else?
Melissa Blasius-Nunes has a question. Melissa, your microphone is live.
Hi, Melissa Blasius from ABC 15. The question that I had is about this lengthy ramp-up time to do full contact tracing. It seems like we might get hit by a big upsurge in number of cases as people are going back to work before we can fully contact trace them. What's the concern about spread of the virus under these circumstances?
So the ramp up to contact tracing and then how that might be affected as businesses open back up, people return to somewhat a level of normalcy, even though I believe the governor said this is not a return to normalcy in his press conference yesterday. Marcy Flanagan will take that question.
Hi, thank you for that question. So we have continued to do contact tracing and case investigations since the beginning of the pandemic. So although this process we are ramping up, we will continue to reach out to every single positive case and their contacts. It may be through the case-mediated plan at this point, but having individuals, we had 5 that were trained last week, 14 that are trained this week. I think this is a pretty expedited process, and we're excited that we're going to really be on top of the cases when they start to come in.
La pregunta fue que subirán el número de casos ahora que muchas personas regresan a trabajar y cómo se contactarán estos casos. Y la respuesta es que se le da seguimiento a cada caso. Salud Pública ha empezado a dar seguimiento a estos casos desde el inicio de esta pandemia. Ahora que se ha contratado nuevo personal, incluyendo 5 que se entrenaron la semana pasada y 14 que están siendo entrenados esta semana, podrá haber más personal para darle seguimiento a estos casos.
Thank you, Melissa, for the questions. I think it's worth pointing out, too, Marcy said this before, but here in Maricopa County, the average hiring time is 45 days or less in most departments. We talked about this plan, which still had a little flex in it on April 23rd. That was 3 weeks ago, and we've already hired almost 20 people with a number of others in the queue for 60 positions. And we've also created these partnerships or enhanced these partnerships that we already have with 211, the Crisis Network, as well as Banner Poison Control. So, Chad, do we have any other questions?
We do. We're going to give Colleen another chance, and if the audio doesn't work, then I will read her question.
All right. Go.
Can you guys hear me?
We can.
Yay. Okay. Thanks for taking my question again. Appreciate it. So I have kind of two questions here. First, will people who are considered close contacts be tested for COVID-19 just automatically by being identified as a close contact, or only if symptoms develop? Then my second question is, in other states, people have had to opt in to things like location tracking data as part of contact tracing. Is that part of the symptom tracker in Maricopa County's plan?
Well, at least for your first couple of questions, I know Dr. Sonnenschein can take those.
So, no, I forgot the first question.
It was about, will they automatically be tested if they're a contact?
Thank you. So to answer your first question, contacts who are, have been exposed to a case during their infectious period will be notified of their potential exposure and told of what symptoms to watch for. Anyone is able to put a mask on and seek testing at that point in time. However, we will be tracking specifically for the development of any COVID-19 symptoms. And if they do develop symptoms, public health will reach back out to them to ensure that they know where they can get testing and how to make that happen. But that will not automatically occur unless they do develop symptoms consistent with COVID-19. And your second question was enrolling them in location tracking data. And that is not something that we have in place right now. We do have the ability to track where these individuals live, and we are asking them to stay at home as much as possible. But this is not something that we will be enforcing with any type of law enforcement. We are all in a community, and we know that this is an infectious disease, and we know how severe it can be and how vulnerable some of our community members are. And we hope that when public health contacts someone and asks them to stay home and away from others, that they will follow those recommendations to protect themselves, their family, and their community.
La pregunta fue que se harán pruebas a las personas que se consideran contacto cercano a una persona infectada con COVID-19. Y la respuesta es que se les va a notificar a estas personas, se les va a dar atención a los síntomas que están presentando. Si esas personas son consistentes en los síntomas de COVID-19, entonces se les va a referir a dónde pueden hacerse las pruebas. Si no presentan síntomas, no se van a hacer las pruebas. La otra pregunta es que si se le va a dar seguimiento a las áreas donde estas personas están visitando cuando están bajo sospecha de que pudieron haber estado expuestos. La respuesta es que por ley no es algo que se le tenga que hacer. Sin embargo, esperamos que una vez que Salud Pública del Condado Maricopa les contacte, les diga del riesgo, se puedan quedar en casa para evitar la propagación de COVID-19.
All right, thank you for the question. Chad, do we have anybody else with a question?
Rocio Hernandez has a follow-up question.
Okay.
Rocio, your microphone is live.
Thank you. I wanted to know if there's an estimate of a cost for the expansion of the staffing of the new hires, and if there is a cost associated to, extending the partnerships.
There is a cost to that. I don't have an exact figure, and I'm checking around. We don't have an exact figure with us right now. I'm happy to respond to you if you'll send me an email. Go ahead and send that email to caomedia@maricopa.gov, and I'll try to lock down a response to, or an estimated cost on that. Obviously, we don't know how long we're going to be doing this, so we'll give you an estimated cost on how much we might spend before this is all over. Chad, do we have somebody else?
We do. Ann has a follow-up question, and
Okay.
your microphone is live.
Hi, I had another question on the long-term care. I'm wondering, are you seeing more COVID cases in assisted living or in nursing homes? And could you talk a little bit about the differences between those two facilities in terms of being vulnerable, to an outbreak of infections?
All right, thank you for the question, Ann. Dr. Sonnenschein will take that question.
So both skilled nursing facilities and assisted living facilities are communal settings. So they're both at higher risk than the general public. They also tend to have residents that are often 65 years or older and who have chronic medical conditions, putting them at high risk. The difference really between skilled nursing facilities and assisted living is that you typically have staff going from room to room in a skilled nursing facility. And that And those staff are able to leave the facility, are exposed to the population, and then come back in. So that puts those individuals at somewhat of a higher risk of being exposed to people who have COVID-19. And that's why it's so important for us to work with those facilities to make sure they have the personal protective equipment that they need in order to keep their residents safe when they do go from room to room. Assisted living facilities are often closely associated with nursing homes or other levels of care in full communities. And so when we encounter a facility that is having an outbreak or even just one case, we don't just work with that facility, we work with the entire campus or system of communities that's with it. And that's why we're working with a lot of assisted living facilities in addition to long-term care and skilled nursing facilities, because when they're in the same system, they tend to share staff, people go back and forth, and they're all at risk.
La pregunta fue acerca si hay más casos en asilos o en viviendas en casas de vivienda asistida precisamente por COVID-19. La respuesta es que son sitios de alto riesgo, ambos lugares, y el personal por lo regular tiende a ir a trabajar y luego sale y puede estar en riesgo de traer también a las viviendas o a estos sitios donde se le da cuidado médico de largo plazo a las personas que por lo regular son personas adultas mayores y con enfermedades crónicas o mayores de 65 años. Entonces, por eso es muy importante proveerles lo que viene siendo el equipo de protección personal para que cuando visitan de cuarto en cuarto o habitación en habitación y se les da el cuidado médico a las personas, no están poniendo a nadie más en riesgo.
Chad, do we have anybody else with a question?
We do. Peter has a follow-up question. Peter, your microphone is on.
Hello, everybody. Quick question regarding staffing. How many positions are you hiring for the investigators and also for the contact tracers? And what kind of educational and professional background are you looking for the people to fill these positions?
All right, good question, Peter Seymour, KTAR. So Marcy Flanagan will take that question, talk a little bit more about how many positions we opened up and what kind of education level it takes to get one of these positions.
Hi, thank you for that question. So we are initially hiring 33 investigators. The requirements for those positions are typically a bachelor's degree or higher with an emphasis in public health, epidemiology, or a related degree. And so we're also hiring 11 nurse epidemiologists, and those typically have a registered nursing degree. We also are hiring 4 data analysts, and then that does not include all the positions that AZ-211 will be bringing on, and also we will have those positions already created. So past July 1, if we need to hire on more individuals, we'll be able to do that.
La pregunta fue que si cuántos son investigadores y cuántas personas se está contratando para dar seguimientos y cuánto entrenamiento se les ha dado. Bueno, la primera pregunta es cuántos investigadores, son 33 en total lo que se ha contratado al momento. Tenemos a 11 enfermeras de epidemiología y también que tienen licenciaturas en epidemiología, también 4 personas analistas de datos.
All right, good question. Chad, do we have anybody else?
Melissa has a follow-up question.
Sure.
Melissa, your microphone is live.
Hi, again, thanks for doing this. I actually
Sure.
have 2 questions. The first one's fairly quick. It has to do with the long-term care facility testing. And the White House apparently had told state leaders that they wanted to see all those tests done within 2 weeks. Seems that's probably impossible in Maricopa County at this point. Just wanted some clarification on that. Secondly, what is the plan for kind of reopening county government offices or facilities? What you guys are telling workers about whether or not they should come back to the office, or precautions being taken, as well as like when does the library reopen, that kind of thing. Has that been discussed through public health, developing some guidance there?
Well, I can answer your second question first. How about that one, Melissa? And thank you for the good questions. Our leadership here in Maricopa County is continuing to develop plans. We have decided to extend teleworking, and we have a great percentage of our workforce right now that is teleworking. And so we're going to continue that through the end of this month while we continue to refine those plans on how we're bringing people back. As far as public-facing parts of our operation, whether it's the counter at planning and development, for example, we are going to adopt some safety measures such as the plexiglass shields that you're seeing in grocery stores and that sort of thing, so people can still come in and interact if they need those types of services. One of the interesting things about going to this teleworking environment that we've gone to and putting so much of our permitting and that sort of thing online, obviously, and that volume has not reduced at all. Most people are going and using those online services. So we've ramped up online services that were already in the works, or we've enhanced them so they operate better, and but those counters will open up once again. As far as the safety of our employees, we are providing masks and have been providing masks for more than a month now to any employee that has to come back to an environment here at Maricopa County. We have staff, more than 13,000 employees across the county, about 150 plus buildings across the county. A lot of our crews, such as transportation crews, they work out on the roads or they work in our parks, so they're not in buildings. They might already be physically distanced from other people just by the nature of their work. So it really kind of depends. You asked specifically about libraries, and I would refer you to the library district. But for the moment, at least through the end of this month, the library district's plan at this point is to remain closed. Some of those libraries, in fact, most of the libraries, are operated by the Maricopa County Library District. However, they are in cities such as Queen Creek and Goodyear, and those particular libraries function effectively as a city library. So that would have to be done in conjunction with the city and what their leadership wanted as well. So the library district will be working on those plans, and our leadership already starting to refine some of those plans. So I think we'll have more details on that probably next week or the week after Memorial Day. So I think that's as well as I can answer your questions about those plans. As far as long-term care facility and testing and what the White House has recommended and what the state is able to do as well, Dr. Sonnenschein will take that question.
Thank you. Prior to the White House order to test all skilled nursing facilities that are Medicare certified, we had already piloted a process in one of our long-term care facilities by working with a group of healthcare providers to go in and test all of the residents and the staff in that facility so we could work out an effective, safe way to get all the tests collected, the package sent to the laboratory and reported back to public health. So now that we have an established process, we were able to share that process with the Arizona Department of Health Services, who is going to carry out the White House order to get those facilities tested across the state with support from the county because we have relationships with many of those facilities already. Once they complete those testing in those facilities that are mandated by the White House, Maricopa County will continue the process with other facilities at highest risk and prioritize them all the way down the line until we are able to offer testing to as many facilities as possible.
Bueno, la pregunta fue que si se van a hacer pruebas en los centros de cuidado médico de largo plazo y cuánto tiempo tardará. Bueno, que la Casa Blanca ha dicho que en las próximas 2 semanas se deben de hacer estas pruebas en el estado por el número de estos sitios que casi es imposible. Sin embargo, se está trabajando con el Departamento de Servicios de Salud y también Salud Pública ha hecho un programa piloto en una de esas instalaciones para poder hacer estas pruebas tanto al personal como a los residentes que reciben el cuidado médico, saber cuánto tiempo tardan en hacer las pruebas, llevarlas al laboratorio, recibir los resultados. Ahora que ha terminado el programa piloto, se ha compartido esa información con el Departamento de Servicios de Salud de Arizona y estaremos trabajando con ellos para hacer estas pruebas en otros centros de médicos de cuidado médico de largo plazo.
All right, Melissa, thank you for the good questions. Chad, do we have anybody else? We have time for maybe 1, 2 more questions.
Okay, Anne has a follow-up question, and we have one more after her.
Okay.
And microphone is live.
Hi, I have a question about PPE in nursing homes. I continue to hear from nursing homes that they are scrambling to find enough PPE for their employees. Is Maricopa County able to provide any PPE to facilities that haven't had COVID outbreaks? Or is it just those with outbreaks? And are you able, in the ones with outbreaks, to keep up with the demands there?
All right, good questions about personal protective equipment in long-term care facilities and differentiating between those that have cases and those that do not. Robert Rowley with Emergency Management, his group has been handling logistics and trying to acquire as much PPE as possible, so he can address those questions.
Hi, thank you. So the short answer to your question is yes, we have been able to provide PPE to the facilities that are requesting it. Obviously, the biggest request for PPE are facilities that have had positive cases of COVID-19, and so that's where our emphasis is. Just for some perspective, the big 5 pieces of PPE that are critical to the operations in long-term care facilities are N95 masks, face shields, gloves, and gowns. And at this current stage, we're at about a 4-week supply for N95s, a 20-week supply for face masks, a 5 to 6 week supply for face shields, gloves are 14 weeks, and then gowns continue to be our toughest one to supply, although we still are, but those are down to approximately a 2-week supply. So the situation is fluid, although it is improving from previous times when I've had to report on this. So we are getting in more PPE. It's not as much as we would like. It's not as much as a buffer as we would like, but that buffer of weeks out that we're able to maintain a cache of supplies is increasing. So that's a positive development in this case.
Bueno, la pregunta fue que si el condado les da el equipo de protección personal a los centros de cuidado médico de largo plazo, solo los que han presentado brotes de COVID-19 o todos, aunque no presenten algún brote. La respuesta es que sí, se le ha estado dando el equipo de protección personal a estos centros de cuidado médico de largo plazo. Para crear un poquito de perspectiva, las 5 piezas de equipo de protección personal a las que se refieren vienen siendo las máscaras N95, mascarillas faciales, guantes, las batas quirúrgicas y lentes protectores. También se tiene para lo que viene siendo para un poco de 4 semanas en las mascarillas N95. Para las mascarillas faciales son 20 semanas que tienen. También para los guantes 14 semanas, para las batas quirúrgicas son 2 semanas. Y siguen llegando estas dotaciones, aunque quisiéramos que hubiera mucha más.
All right, thank you very much. Good question there. One more question, Chad?
Yes, Colleen has our final question.
Okay.
Colleen, your microphone is live.
Hi. Okay, so just a clarification on one of my previous questions.
Okay.
So I asked about kind of tracking locations, and I hear that, that the county has the ability to track locations, but it's not going to be used to kind of enforce people staying somewhere. So how is the county tracking locations? And then if I could, just one more question too. July 1st, the kind of goal is 400 to 500 cases a day that investigators will be able to contact 7 days a week. What was used to calculate that goal? Are you anticipating needing to contact that many cases by then? And does that speak to what we could see here case-wise in Arizona?
Okay, so I want to clarify really quickly. When you say track cases, are you talking about putting an ankle bracelet like law enforcement does on somebody, or making somebody put an app or some sort of technology on their phone? I know there's been a lot of speculation about what could be done. Is that what you're asking about?
Yeah, I'm trying to understand exactly what is meant by, because I heard, at least, and maybe I'm hearing wrong, but I heard that, the county has the ability to track someone's location, but it won't be used, to make them stay where they are, make them stay home. So I guess I'm trying to understand
Sure.
What's meant by that.
So Dr. Sonnenschein will answer this question on what she meant by tracking people. But let's be very clear that we're not putting some sort of technology on people's phones once we contact them and perhaps invading their privacy. There's a lot of legal questions whenever it comes to that kind of technology. But I do know that has been out there in various news stories across the country. So I want to be clear on that, but I'll let Dr. Sonnenschein fill in the gaps.
just to clarify, the county does not have the ability to track anyone's movement by any means on whether they're staying home or going to work. There have been studies reported where people have used aggregate phone data or mobile device data to track populations. And we have seen some data from the county, from aggregate data, but we do not have the ability to track individuals. What we do have is a person's home address and their work address, and perhaps if their child goes to daycare or school, we have that information, but we, again, do not track whether they are leaving the home or going to work. Except in certain situations, if it's a high-risk occupation, we may notify the employer to ensure that that individual isn't exposing other individuals.
Bueno, la pregunta fue si se le va a dar seguimiento a las localidades, a los casos positivos y si tenemos la manera de dar seguimiento a dónde está esta gente, a dónde va todos los días. La respuesta es que no tenemos la capacidad de dar seguimiento o seguir a la población que está siendo investigada por COVID-19 o que presentó los síntomas. Lo que sí tenemos es la dirección donde vive, la dirección donde trabaja, la dirección quizás de la escuela o del centro infantil donde cuidan a los niños. Sin embargo, no tenemos nosotros una manera de rastrear dónde se presenta cada persona o cada uno de sus movimientos. Lo que sí podemos hacer es que si la persona trabaja en un empleo de alto riesgo, entonces sí le podemos notificar al empleador para que sepa del posible riesgo.
And you had another question about how many different contacts we can make per day. Marcy Flanagan will address that.
Hi, thank you for that question. So the question was, how did we come up with the target of 400 to 500 case investigations a day? So we really looked at what we are providing right now and looked at what do we think the maximum number of cases we could see come in on a daily basis, and that would be 400 to 500. That would be almost 4 times what we're seeing currently on a daily basis. So we thought that was a really high number to shoot for, and that's the target we're using right now. If we need to adjust that at all, we have the capability to do so.
La segunda pregunta fue que si cómo se llegó al número de 400 a 500 casos y cómo se calculó llegar a dar ese número de investigaciones a diario, ahora con el nuevo personal. Bueno, la respuesta es que al momento se le da seguimiento a todos los casos y pues, ponemos en práctica todo lo que tenemos. Sabemos que podemos ver en un día, por más alto que sea, 400, 500 casos. Entonces estaríamos viendo 4 veces más de lo que se ve a este momento.
All right, great questions today. I'm glad we got everybody taken care of, I hope. You know how to reach us in the Joint Information Center. Please reach out if you have other questions that you have to complete your story, or if there's any confusion about any of the answers you received today. We appreciate all our friends in the media joining us, asking good questions, and giving us the opportunity to clarify anything you might be covering today. So also for those of you who are joining us on Facebook and on YouTube, thank you for being here with us and continuing to spread the information, allowing us to get into your homes and through your phones and whatever it might be, so we can communicate with you directly. So thank you, everybody. We will let you know when we're having the next availability, probably next week. Thank you so much.